Hi, everyone. My name is Jennifer Simpson, and welcome to another episode of Here's the Deal, virtual edition. Today, we're going to be talking about the impacts of COVID-19 and Huntington's disease, how they might be impacting your life, what you should worry about, what you shouldn't worry about, and how to handle some of the mental health implications of these new times that we're living in. We're very lucky to have two great resources with us today. The first is Dr. Victor Sung. Dr. Sung is the chair-elect of the HDSA Board of Trustees, and he's also the director of the Center of Excellence at University of Alabama, Birmingham. We also have the lovely Dr. Arik Johnson. Dr. Johnson is a licensed clinical psychologist at the Huntington's Disease Society of America Center of Excellence at UCLA, and he's also the immediate past chair of the HDSA Board of Trustees. So welcome, both of you.
Thanks, Jennifer.
And I'm glad we're all in the plaid club today. We coordinated this. Yeah. So Victor, I'm going to start with you. Let's talk a little bit about COVID-19. We've heard a lot about it. There's been some misinformation about, oh, it's like the flu or it's something else, how we can transmit it. Can you just tell us a little bit about this novel coronavirus and how it might impact a person?
Sure. I think, it helps to go break it down. So the name COVID-19, it stands for coronavirus associated disease from 2019. So the coronaviruses are a family of viruses that we've known about for a long time. But this novel coronavirus that really came to the forefront in late 2019 and is causing all this disease is the source of this pandemic and all of this hullabaloo that we've had to do both nationally and globally. The things about it, I think there are pros and cons of the comparison to the flu. I mean, I think there are similarities in the symptoms that it causes in a person, and it is a virus, just like flu is caused by a virus. But I think that's kind of where the similarities end. And I think to make it too similar to flu kind of underestimates the impact of the disease. The things about it are that COVID-19 is much more lethal, has a much higher hospitalization rate than the regular flu. I guess a simple way to think about it is that COVID-19 is about 10 times more deadly than the regular flu. So, and that's based on the data that we have. So in 2019, in our most recent flu season, we had 35 million cases of the flu in the United States and 34,000 deaths. That's a death rate of right about 1%. But the death rate for COVID-19 in the United States has really been about 10%. But then you have to factor in that that's 10% of all the cases that we call as positive, but we know that 20 to 30% of people with COVID-19 are asymptomatic. I mean, we have no idea of how many people who carried the flu and never developed symptoms because those people never got tested. So I would actually say that, those are our conservative estimates that COVID-19 is 10 times more deadly than the flu, but it's probably a lot more deadly than that. And then the other thing too is the flu season stretched over many months, and while our shutdowns and things like that may last that amount of time, this amount of intense waves of patients hitting the hospitals is really over a short amount of time, like days to weeks instead of months and months. So a lot more lethal, a lot more people in the hospital, and hitting the hospitals a lot harder, just a higher concentration. And I think that's how I would summarize how we should kind of think about COVID-19 in general.
Yeah, it seems like for folks who might be having sort of the thought of, well, like, oh, if it's like the flu, I might be a little bit symptomatic and then I'll get better. But it seems like the biggest point is that there probably are and will be many, many people who will be carriers of the virus but not know it and could spread it to folks without having any realization that that's what they're doing. And then those folks then could spread it to more and more. And that's when you get the overwhelming of the hospital systems, where folks who are in a vulnerable state or folks who might be immunocompromised end up going to a hospital that's already out of beds.
Yeah.
So to think about that, does how does having Huntington's disease in particular, how can that impact a person's experience if they contract COVID-19, if they become sick? Does HD make it, is it a risk factor? How should people be reacting here?
Sure. I think, that's a big question. I've gotten that obviously from a lot of my patients as well. And I feel like, the stuff that's been listed out there on what are risk factors for getting the virus are mostly older age and having things like diabetes or being immunocompromised. And HD doesn't really fall in those categories unless you have HD and do happen to be in that older age population, or and you also do happen to have diabetes or some of these other risk factors. But HD on its own doesn't make you immunocompromised, and just having HD, compared to say you're, middle-aged and don't have any risk factors, you don't necessarily have a higher risk of getting COVID-19 than anybody else your age with your risk factors.
Right. So it's not automatically a thing where you need to be hyper worried that if you happen to be exposed, that you're going to be, the symptoms will be worse, or you have a higher chance of hospitalization.
That's right. I think but to your point though, say you have HD and you do contract COVID-19, how would that change your experience or with the disease? I don't think it's necessarily, like you said, more likely that you will develop symptoms if you contract the virus and you have HD. But if you were to develop the symptoms of the disease and you had more advanced stages of HD, and we know that HD can involve swallowing and things like that, then most of the problems with COVID-19 are related to the pulmonary or the lung related complications of the disease that require people to be on ventilators and things like that. So breathing related issues, and if swallowing is also already an issue with your HD, then breathing could be an issue too, and you might be at more risk for those kind of breathing complications of the disease. Although we don't, that's what we would all guess, but we don't have data on that. We don't have numbers specifically about that.
Yeah, we're sort of in a best guess stage still. This is a sort of in a similar topic, and I'm going to open this up to either of you. I just was thinking, if someone is also impacted by, let's say, some of the unawareness that can come with HD, or perseveration, or sort of obsessions, how do you think how could that sort of impact someone, or what advice would you give to maybe a caregiver who's with a person who might be experiencing some of those symptoms of HD, the behavioral symptoms of HD, to try and keep them safe? Because I'm imagining someone who might also be sort of have some unawareness, or have something that they're perseverating on. Oh, I have to do this. We have to go buy this. We have to go get this, and might be putting them in a higher risk situation of being exposed to COVID-19. Are there any sort of thoughts that you guys have about that?
Hey, Victor, I'm going to go with that one for a second.
Sure.
To your point, Jen, the concerns of some of the behavioral concerns with HD, right? The perseveration, that kind of fixed focus on, I need to do this thing, I need to do it now, coupled sometimes with impulsivity and that kind of inability to self-censor and self-correct. And unawareness. You combine all of those, or any degree of any of the three, and it has a potential to impact someone's practicing best behaviors right now, given the recommendations we have about social distancing, about limiting your time outside of the house. Things that I would recommend to a caregiver or someone whose loved one has HD and might be exhibiting any of those symptoms, right? Perseveration, impulsivity, unawareness, would be to do something that we talk about all the time, but to maybe refocus it given some of the current recommendations, which is to give frequent and consistent recommendations. For example, say someone gets really obsessed with toilet paper, which isn't just an HD thing. Let's just say most people seem to need a lot more toilet paper now than they ever have. You have that drive to say, we have to go to the market now, we have to get that toilet paper. And to be able to respond and say, you know what, let's make a plan, let's set a time, let's pick time of the day that we think there's going to be less people there, and we'll work towards that. You might have to repeat that message frequently.
Mm-hmm.
Let's look at the plan that we made. We set a time. We picked a place to go. We're going to go there at 3 o'clock today. You might have to say it 100 times before 3 o'clock, but the more that you say it, the more that you reinforce that boundary, and the more you stay consistent in your messaging, the hope is that's going to manage some of those kind of driving feelings and thoughts that the person might have. It can be hard for the person who doesn't have HD to have to repeat the same thing multiple times, because they might also be stressed and worried about having enough toilet paper. So it really is about saying we got to just set a boundary and then maintain that boundary and stay consistent in the way that we present it. That would be a recommendation I would make as far as a behavioral intervention for that.
Yeah, thank you, Arik. Those are excellent recommendations. And I imagine this is also, in a time where we're all getting creative, a time when it could be, you might have to get creative with some of your caregiving strategies. If going out is really not going to be a good option, finding some kind of way to help to sort of still say yes, and redirect, but without actually putting yourself in a situation where you're not practicing best, you're not doing best practices, not doing social distancing. So finding different ways where you can just kind of get as creative as you can with your loved one, and help them manage at this time too, and allow you to manage your own anxiety as a caregiver. That's a huge point. Yeah. Now, thinking about that, Victor, if you are someone who has HD and you have a neurologist appointment coming up at the clinic, or say you're at an HDSA Center of Excellence, or you might be seeing your local neurologist, what can you expect to happen?
Yeah, I think that's something even for us as physicians, we are that's in flux. It seems to change day by day. We're not sure what we're doing about that. I mean, we had a long meeting about that just for my HD clinic yesterday for our upcoming HD clinic. What are we going to do about it? For those patients and families who are used to going to the big multidisciplinary clinics, I would imagine that most of those clinics like ours are going to put that kind of multidisciplinary care on a pause, because that's a lot of people being exposed to each patient, or exposing each patient to a lot of different people in risk. So, our clinic, our multidisciplinary clinic, we're going to put that on a pause. But we're still going to do a separate social worker call, and then a separate call with the clinicians, the neurologist and or the psychiatrist. So I think a lot of clinics are rolling out telemedicine. I think for clinics that either in private practice or at a center of excellence that already had that capability, they're just leaning on that and using it more. And maybe a lot of patients and families are already used to doing that. But I know for our clinic, Alabama, maybe that's not a surprise to anybody, was very far behind in the use of technology and telemedicine. But that's been one good thing that's come out of this, is it's really pushed, and a lot of that was driven by payers. The different payers in our area were not willing to pay for telemedicine, so then nobody wants to do it because it's a hassle to do it if nobody's going to pay for it. But they've loosened all of that immediately with COVID-19. So they're going to reimburse telemedicine visits just the same as regular visits. And that's going to open things up. I think that's what patients and families can expect, is that a lot of people are going to try to go to telemedicine, either telemedicine with video or telemedicine on your phone. I think either way is okay. I find that with my HD patients, if it's a return patient, someone I know, if the video is not working and I can't see them, I think the patient and the family can usually describe things enough in a way that I can get enough of a picture even without being able to see them with the video. New patients I would find to be hard. I'm trying to do the predictive testing patients, or patients wanting to get testing and those kinds of things by video. And then obviously if you need to get a gene test, you'll have to come in and get your blood drawn. So those we're still doing in a more traditional way. But I think having that flexibility is important. The other thing too is I've found that my patients have more to say on the phone. I don't know what that is, and they tell me more things, and we perhaps go into more depth than we used to. But on the patient and families end, I know for me as a provider, I love it when patients and families have prepared for the call. They've written down things that they want to bring up with me, and that makes the time go smoother.
Mm-hmm. Yeah, so if you're a family member, if you're a patient, to be thinking about, all right, what are the things that my neurologist needs to know? What are the things my psychiatrist needs to know?
Mm-hmm.
Or if I'm working with, if we've got some PT or OT work that we're doing, what are the things that have been bothering me, or the things that we've been struggling with, so we can kind of like jam it out when we get on the phone, basically, so we can make sure that we're hitting all the points that we need. Another big thing that it seems like we all have to be ready for is just flexibility, right? Is recognizing that we're trying to maintain some sense of normalcy and sense of continuity in care. So making sure that, if you've got an appointment scheduled, you're probably not going in person, but there's a very high chance that you'll have a phone call or a video conference with your doctor coming up. And I think that's not only for, what's happening in HDSA centers of excellence, but you can probably expect that from your primary care doctor, from all kinds of folks, and your psychiatrist, which is a really great point. So just having that recognition, like, okay, we're going to have to do a little bit of rolling with this. This might be how we do it this week. The next time I have to have a visit, it might be completely different. And just sort of staying in touch.
Jennifer, I've gotten some pushback from patients, because a lot of the calls to initiate the change from a regular visit to a telemedicine visit might be by a scheduler or a secretary or somebody who doesn't have a relationship with the patient and the family. And it seems kind of cold. And I've gotten feedback from, the scheduler will send me a message saying, this patient was upset and thought that you didn't want to see them and you only wanted to do a telephone visit. And I usually will then call them and say, like, hey, it's not that. It's not that I don't want to see you. We really are trying to keep everybody safe. And the other thing too is at least at our institution, they have, for all outpatient visits, they've banned visitors, meaning as long as the patient can wheel themselves in by a wheelchair and doesn't require being pushed in a wheelchair, they have to go by themselves if they're going for an in-person visit. They will force the family member to sit in the car. So that would be problematic anyway. I think the usually valuable for me when I see an HD patient in person to see the whole family, or to see, whatever caregiver network they come with, and they provide so much other information, and, we try to provide support for all of them. So if that's just not even going to be possible, then I would say, let's just do it all by phone, and everybody can be on, speakerphone or something like that.
Hey, Jen, can I ask what Victor said?
Yeah. Please.
I think it's important because we can speak to what we're doing at our specific locations, right? Like what we're doing in our own hospitals and clinics. But I think for the people who are going to be watching this and knowing that we've got an audience across the country, it's important to encourage people to reach out to their doctors and say, what is going on where we are right now? What are the recommendations at your clinic, at your hospital system? Because there are, like Victor said, you guys might be in a different place than we are in California, just with how different protocols and policies are being enacted and recommended. So I think it's important just to think about, whoever is watching this, where are you? Who do you see? And to reach out to that person and say, how are we going to do this? You can do that preemptively too.
Yeah, exactly. Right. So this information is good if you're going to see Dr. Sung, for example, or you, Dr. Johnson. But to think about it, make sure you're checking with your own provider. Make sure you're up to date on what's happening with the clinic that you go to, the providers that you see, because that's what's going to be the most relevant information for you. Thinking about all of this, if you are a caregiver, Victor, and you think, and you have a loved one with HD, and they lose their sense of smell or taste, they spike a fever, they have a dry cough, what are the things that you should do? What are the procedures that you need to go through if you suspect your loved one might have COVID-19?
Yeah, I think that's a great question. And I think just to piggyback on what Arik's saying, I think that's really no different. Before you just rush into the clinic or rush into the ER, call your doctor. I think almost across the board, people are saying, don't just go get tested. Don't just try to, go to some random testing facility or, go to your local ER, things like that. Call before you go, get some advice from your doctor on what you should do. And, take that advice and before, because if you don't need to go to the ER, any trip to the ER is, if it's unnecessary, is just going to expose you to risk. So.
Yeah. And that's, I think, a great point. In New York, there's been a big push to, if you think you have symptoms, don't stay home. Don't immediately go to the hospital. They're overwhelmed already. If you are not in need of immediate hospitalization, talk to your doctor and try and manage your symptoms at home. But again, always consult your physician, consult the folks that you work with to figure out what the best practices are going to be for you and for your case. Now, knowing that the best practices right now involve social distancing, quarantining at home, closing up non-essential businesses, that can lead to a real sense of isolation. Even if, you're in a home with 30 people, you might feel extremely alone during this time. So Arik, I wanted to talk a little bit about what we can do here. Isolation is something that folks with HD can experience regardless of any global pandemics. How can being socially isolated in particular, impact how a person might feel, a person's mood or their thought patterns? What might people be experiencing?
In the last couple of weeks, I've been looking at some of the literature on isolation and loneliness, and we see that people who feel isolated and lonely, and people who are now practically isolated, can have an impact on their physical, mental, and cognitive health. We see that people have physical changes, like changes in sleep, either sleep disruptions or they're sleeping too much, or they're not engaged in the same kind of exercise regimen as they are, which for our neurological patients and HD patients, we know how important it is to engage in exercise and to stay physically active. We know that people can become depressed, anxious, afraid, down, fill in the blank with a negative emotion when you are isolated and lonely.
Yeah.
And then we do see that people can experience cognitive impairments too. We can see decreases in executive functioning. We can see accelerated cognitive decline when someone is isolated. So the very real fact is that people who are isolated are prone to these kinds of physical and mental changes. Not just the person with HD, but anyone who is in that situation.
Yeah, as I was hearing you sort of list off so many of those impacts, I was thinking, oh my goodness, if I were pre-symptomatic or at risk, and I was starting to experience, maybe I'm a little bit slower in doing some tasks, I feel, I might be experiencing some of those cognitive changes, mood changes, depression, anxiety, knowing that can also be how a person who is starting to experience Huntington's disease can also feel. I think a big thing to watch out for here is maybe symptom hunting if you are in that while experiencing isolation.
Yeah, I think that's a great point. The things that people are experiencing now, it's something I think we talk about a lot with HD. HD is not a sprint; it's kind of a marathon, and symptoms aren't just going to start piling up overnight. We are in this place right now, and it's been a matter of weeks, right? So if someone all of a sudden is saying, yeah, I've got all these things and it's all happened within the last week, chances are that's not Huntington's disease. Chances are that is a product of what you're dealing with right now. We're not going to rule it out, but we got to say, you got to look at all of the potential factors that could be contributing, because this is going to have a large effect on a lot of people.
Yeah. So sort of instead of doing that, sort of jumping to that, it might be that little worry that's in the back of your mind if you're at risk or if you're pre-symptomatic anyway. Is this it? Is this HD? Ask yourself those questions. Okay, when did I start feeling this way? When did I start maybe forgetting words? When did I start having trouble remembering where I put things? When did all of this begin? If it's in the last 1 or 2 weeks, that might be also a good way to kind of give yourself a reality check. Say, oh, okay, this might just be because I haven't spoken to anyone in 10 days, or I haven't been engaging in self-care tasks for a long time. And I'm also sitting at home and I'm checking the news every 5 minutes and I'm looking at social media every 2 seconds, and it's just building and building and building. So, I mean, knowing that, it can be really hard to avoid feeling panicked during this time, because I'm sure for you guys and for the folks who are watching this, we're getting a lot of news alerts on our phones that are, outbreak here, death toll here. It can be tough not to feel panicked. What are some of and we know that also anxiety and depression can manifest themselves in your body, right? A lot of times you might not recognize that you're feeling anxious, but your stomach hurts, or, any number of things. What are some of those body symptoms, those somatic symptoms that someone can be kind of on the lookout for to say, all right, I might be ramping myself up here. I need to go and do some self-care. I need to go and manage this for myself.
No, I think your point is great. There's a lot of overlap between the symptoms of depression and anxiety, but I think right now there's some physiological things about anxiety that I want to point out, just because I think people are feeling more worry and panic and fear and those kinds of feelings. The things that we watch for and that we talk about are just kind of that general sense of nervousness or restlessness or tension, right? Like your body just feels kind of wound up tight. Feeling like an increase in your heart rate, or feeling like your breathing is getting more shallow, which is hard right now too, because people are maybe not breathing fully because they're nervous, and then reading that as, oh my God, I've got shallow breathing, or I've got shortness of breath. So is that the disease? So they kind of feed each other. Physical tension. I always do this. It's like, if you feel like your shoulders are getting close to your ears, chances are that you are feeling anxious or stressed. GI stuff, right? People are experiencing upset stomachs when they're anxious. When we're panicking, our digestive system is not doing what it's supposed to, and we're going to notice that change. And then some of those non-physical things, feeling a little bit confused or having a hard time concentrating or paying attention to things. And then also sometimes just a general sense of feeling like you don't have energy, or you're feeling weak, or you're feeling really tired, or you're having a hard time sleeping. These all can be signs of anxiety, and some of those physiological features of the anxiety, panic, fear symptoms. So things to just watch for is, what is going on in my body? Does it feel different? Is just a simple question to ask yourself. But then particularly if you're feeling any of those big ones, tension, increased heart rate, feeling like your breathing is a little bit shallower, you feel a little tension in the center of your chest, GI issues, pay attention to those things. That could be a sign of anxiety, that physical manifestation of the fear and worry.
Yeah. And let's say you are starting to experiencing anxiety, maybe even panic, like you might be finding yourself having sort of minor panic attacks, and you need to interface with a mental health professional. You need to either speak with your psychiatrist, speak with your therapist. What are good ways how are people being able to interact with their mental health professionals during this time?
Again, I'm going to say this is if you already have someone on board, call them, ask them what their practice is doing right now. Much like Victor was saying, we've switched all of our appointments to telemedicine, except for emergency appointments. And so I'm doing a lot of visits like this, where we're talking over the computer. If you don't have the tech, if you don't have a computer or a smartphone, we'll talk over the phone, right? There's ways to do this right now. So if you've got someone already on your team, if you've got a psychologist or a therapist or a psychiatrist, reach out and find out what they're doing. But then also look, because there's a lot of resources that are becoming available right now specific to this current situation. A lot more people are doing telemedicine or telehealth. We've got through HDSA telemedicine, the mental health professionals that we interface with. So you can do that. If you don't know where to find them, call your HD specialist, ask them for referrals, look on on the HDSA website, and do a Google search for mental health professionals, telehealth. I mean, there's a lot of resources out there right now, but getting in touch with the ones you know. You're here watching this, Here's the Deal talk on HDSA.com, so look on the website or reach out to the HDSA social worker.
Yeah, and Arik, you make such a good point. If you, for example, if you're someone who's not yet engaged with a mental health professional, if you're not engaged with a therapist, right? HDSA has the telehealth initiative where you can get 8 free sessions over the course of a year with a licensed therapist who's been trained, who knows about HD, because we've made sure of that. We've trained all of them. That's an amazing, amazing resource that folks can use, and they can find it again on HDSA's website. Same thing with the support groups. Like, support groups are all moving online. They're either using Zoom platforms like this, or they're using the online support group platform that we already have. You know, the resources are there, and they're growing, which is a really important point as everyone kind of moves into this virtual space. The other thing I wanted to touch on with you, Arik, is social distancing doesn't mean social isolation, right? You don't have to never speak to your friends or family again just because you can't necessarily go to their house and have dinner. So what are ways that people can try and minimize their isolation while still social distancing?
You know, kind of doing what we're doing right now. I can't, for anyone who's watching this, I am so happy to see Jen and Victor right now, just because it's nice to be able to connect with people that you know in a meaningful way that might not be the same as what we do when we get together in person, but oh my God, it's so nice to see a familiar face. So if you've got the technology, use it. FaceTime someone, set up a Zoom get together with friends and family. If you don't have the tech, call someone, pick up the phone. You know, I can tell you, I'm not the best about making calls anymore because you just text people, but it's so different when you actually hear someone else's voice. If you don't have that social network, reach out to some of the resources that we just talked about getting connected with an online mental health professional, or get onto a virtual support group, just as a way to stay connected. Another thing that we're all practicing the social distancing so that we're not getting up in each other's space. But if you are getting outside and taking a walk and you see someone up at the top of their driveway, talk to them from the end of the driveway to the top of the driveway. Say hi. Just don't get too close. Don't go up and, compromise someone else's personal space. But I've been walking my dog and yelling at other dog walkers across the street right now, and that's good social connection. Yeah.
Yeah, exactly.
It's just nice to see that other person sometimes. So you can take advantage of those things, but use the tech, use the phone, call people, and look for things that you can participate in that might give you that sense of community. Being on an online support group, getting together for that virtual happy hour, or virtual dinner, or virtual church session, or whatever. There's all those different kinds of.
Yeah, anything that you can do. The other thing that I think can be really helpful is scheduling. So you've got something to look forward to as well. I think that can be another strange impact of social distancing and quarantining, is this weird sense of time. Now that people are working from home, if you're at a point where you're working from home, or you might be on sort of furloughed from your job, it can be harder to kind of keep track of time when every day feels a little bit like Saturday.
Yeah.
So keeping plans up, making sure that you've got something going on. If you're talking to your sister-in-law tomorrow, reach out and see if you can schedule something for later in the week. So you've got these little social engagements that are going on throughout your time, and you can better keep track of time as well. And it gives you something to look forward to. It can give you something to do, something to prepare for. It's always good to feel kind of a sense of purpose at a time when it can feel strangely adrift.
Absolutely.
And I want to sort of just to plug those groups again. Again, if you want to learn more about the online support groups, you can go to hdsa.org/OSG. And if you want to learn more about the telehealth program, go to hdsa.org/telehealth. So I want to thank both of you. Thank you, Victor. Thank you, Arik, for talking with me today a little bit about this strange, yes, thank you. Sorry, it's my dog Sadie who has a lot of things to say about this. Yeah, what's your input here, bud? About what's happening in this time of COVID, how HD families can stay connected, how they can manage their symptoms, manage their anxiety, and also find a way to get through this together. So thank you all. I appreciate it so much. I'm glad that you both are staying safe and staying healthy, and thank you for all the work that you guys are doing for HD families.
Thank you. So good to see you both.
Yeah, good to see you guys.
Yeah, great to see you guys. And that's the deal with COVID-19 and Huntington's disease.